Zoll has pushed the boundaries of what is possible for 35 years, in the tradition of company co-founder Paul Zoll, a Lasker Award-winning physician and a pioneer in pacing and defibrillation. In addition to his seminal research, Dr. Zoll had a reputation for dedication and careful attention to his patients. His legacy lives on at Zoll.
Thank you very much for that introduction. I'm not sure there's anybody who doesn't like soccer. I think this statement is a true one, and I wish it wasn't one that we didn't have to worry about, and that is, of course, nobody goes to a football match expecting to die. Unfortunately, it doesn't kind of work that way. These things do happen, and I think we have to take advantage and we have to do something about it. A lot of what I have to say this afternoon, in fact, has been published in December in the British Journal of Sports Medicine, and that is the sports special considerations for sudden cardiac arrest, which has been taken up by at least the European Resuscitation Council, and we're hoping in our mission to be able to impart that to all of the resuscitation councils as a special consideration. It's become something that is important. It's been taken up by FIFA on a very serious level in terms of research, prevention, and management on the field of play. It's now been taken up by the International Olympic Committee, and the Manual on Cardiology, which is coming out in July this year, has a chapter devoted to the emergency cardiac care, right from school all the way to Olympic events. It's been taken up by the European Society of Cardiology, and there is a manual that is coming out very soon. All of these organizations have recognized that there is a problem in terms of sudden cardiac arrest on the sports field, because what you look at now is everybody that you see here is dead. The youngest at the bottom, where's the... The youngest is on the bottom over here, which is 11 years old. And a couple of months ago, I had two of these in my own country, in South Africa, who both died on the sports field. So this is something that we have to recognize. It is not rare, as people think. We are losing in the world about one premier football player a month. And so it is really there. And so just to show you and give you an example, this is Gregory Martins, who died on Saturday, the 2nd of May. This is a Welsh rugby player who died on the 3rd of May. This is a young guy of 11 who died on the 6th of May. another Belgian player who died on the 11th of May, an Argentinian who died on the 24th of May, an Australian who died on the 30th of May. It just doesn't stop. And so it's something that we have to understand and something we really have to do something about. And it's a fight that we have in our hands because these are young, fit, healthy people who are involved in sport, who want to remain healthy and playing the game that they love. And that's why FIFA, as a regulation, has put out a communique to the entire world to say that you do not undertake exercise, you do not undertake training, you do not undertake a match unless you have an AED at the sideline. The ABC of football at the Budapest FIFA conference was acknowledged as A is an AED, B is blow the whistle, and C is commence the game. And it happens in that order. It happens only in that order. And if you don't have an AED, then don't blow the whistle. It's becoming that important, it's becoming that serious, and we now just have to implement it. And that's what we're doing around the world as we try and implement this. So FIFA has put out 11 steps. Of course, everything in football is 11. Even if it's not, we will make it 11. If there's 6 steps to baking, we'll make it 11. But the 11 steps to the prevention and management of sudden cardiac arrest. And this is something that has now been instituted at all 209 member associations around the world. And the first one, of course, is prevention. We try our best to do prevention. And that has to do with a pre-competition medical assessment. It has to do with an ECG. And if there's anything wrong, it has to do with an echo. But then comes the planning and the protocol, and that comes to training. And training is what we do with the field side medical teams. Training is what we do with those people that are on ambulance standby. Training is what we do with the referees, the coaches, and everybody else that we can get to be able to train them, to equip them, and make sure that they know what they need to do. And then when it comes to the game, there is a whole lot of things that need to be done. We need to make sure that there is an emergency bag. And paramount in that emergency bag will be an AED, because that is part of the game of football now. It's not just the ball, it's not just the whistle, it's an AED, it's part of it. A field-side medical team has to be trained, it has to be equipped, and has to know what to do. And the ambulance that is there has to know what is exactly going on so that everybody knows where they fit into it. And that's why FIFA, for the very first time as a sports organization, has come out with a standard FIFA medical emergency bag. And that is because football players travel around the world. They go to different continents. They go to different tournaments. They go all over. They speak different languages. And every team physician has their own bag. In order to be able to get some kind of equanimity and some uniformity, okay, that across the board, everybody has to have at least a certain amount of equipment. And therefore, this bag is the minimum now standard that should be at a football match, no matter where it is in the world. And prime importance, as you can see in the front, is the AED that is there. And everything inside that bag has to do with a number of life-threatening emergencies, and that is important. So that when teams travel, they travel with the same bag, the same contents. There is consistency across the world as to what the minimum standard is. You want to have more, that's fine, but you can't have less, because that is what is needed. And then there's an emergency plan. And the emergency plan is what you need to do when something happens. And that's important. So what is the field emergency medical plan for football? And this is where CPR and sudden cardiac arrest in the field takes a bit of a special considerations. It's not the normal. There are 4 aspects. We need to recognize it, respond to it, we need to resuscitate, and we need to remove from the field. And there are 4 aspects that we look at in terms of sport, in particular football, when it comes to recognizing a sudden cardiac arrest. This is new. It is not part of the normal basic life support that we teach. And the most important part of sudden cardiac arrest is the non-contact collapse. If you have a player or a sports person who was vertical and without any collapse whatsoever becomes horizontal, it's a cardiac arrest. End of story. Okay, and you saw, and I don't want to even try to go for the videos now because they're going to block up the system again. Okay, but if you have a player just runs and all of a sudden falls flat on their face, that is a cardiac arrest. And we regard that as a cardiac arrest as the most important sign of a cardiac arrest, unless they get up and unless they start moving. If you get to that play and they're unconscious, that is all we require for sudden cardiac arrest in sport. We require nothing else. A non-contact collapse, an unconscious patient, and that person's in cardiac arrest, and we're going to go into action in terms of that. We're not interested in the breathing pattern whatsoever. And we have to teach that, and we have to train that, and we have to make sure that people don't worry, because you're getting to them so quickly, they can still be breathing before they then go to abnormal breathing, before then they stop breathing. We haven't got time for them to stop breathing. We've got to get to them very quickly. And then we have something which is very important, and that is something which has now been published in the new guidelines, and that is the slow, rhythmic, seizure-like activity. And as soon as they go into cardiac arrest, they have these kind of seizures, slow seizure kind of movement. They're not having a seizure. They're in cardiac arrest. And so this is something we have to teach, and people have to understand that in sports, that those four are very important. That the first two is a sign of cardiac arrest. Whether the patient is breathing or not, and the patient is having seizure activity or not, if they're still in cardiac arrest in sports. And we regard that as sudden cardiac arrest, and we do something about that. And that happened to such an extent that, in fact, we had to go and change the rules of football. And that's not easy to do, as you can imagine, to go to FIFA and go to the Football Association and go and change the rules. But we did that. Because at the time, critical nature, to be able to get onto the field and do what you have to do. You can't just run on the field. The referee's the boss. The referee is a complete, autonomous, and you only go into the field, the referee invites you on. And when people collapse and people get injured and people lie down and things go wrong, it's only when the referee calls you in that you as a medical team can go on the field. We've changed the rules. At the moment you have a non-contact collapse and the patient lies there, the medical team will enter the field without the referee's permission. It's completely changed the rules in sport, because we're saying we're not waiting for any referee, for any umpire, for any bunch of people to call us on. If we're a medical team, we're going on ourselves. And that has been changed in terms of the rule of football. And when you get a four-man team, three will run on, one will run to the center, speak to the fourth official, tell them the guy's down, cardiac arrest. Don't wait for his response. Don't wait to see if he understands you. Don't wait to see if he got any idea what you said. Just carry on running. And you get to the person and you start your resuscitation. And that's the way now it has to be in football. It is time critical, and so the rules have changed accordingly. And when we do respond, the side team, medical team goes on, it takes its bag, it takes an AED, and it takes with it a long kind of spinal board, because you've got to be able to get this patient off the field if you can. And so how do we do resuscitation on the field of one is different? We first assess the signs of cardiac arrest. As I said, they're very simple. It's a non-contact collapse, and it's a patient who's unconscious. End of story, get on and do what you have to do. Get the player gently and carefully on his back, because as you can see, these players do not go down gently. They don't put their hands out, because the moment they start collapsing, they're unconscious already, and they hit the ground, and they hit it very hard. And so there may be a spinal injury that we have to take into consideration when these guys collapse onto this hard field. And then we start chest compressions, because that is so easy to do. All you need to do is have two hands. And you've got enough people on the field who want to help. And you've got enough people on the field who are capable, healthy, and fit enough to help. And so we grab them all. And if none of them have ever done external chest compressions before, you can teach them exactly what to do in less than 5 seconds. You put them in position, you tell them how to go up and down, and away they go. The only problem is getting them off so the next guard can come on, because they think they're going to carry on for the next couple of hours. But there's enough people to carry on, and so we start chest compression immediately. It is a witnessed arrest. It is closer than a witnessed arrest. And then we get the AED, and we get it ready, and we use it as soon as it is ready to be able to be used. Because the majority of these patients, over 90%, will be in ventricular fibrillation. Time is critical. And what we start doing is hands-only CPR, and we go right up to 10 minutes. Why? Because these guys have got plenty of oxygen. They've been exercising, they've been running around, the hemoglobin is fine, they don't have an ischemic heart, they're full of oxygen. We need to get it around the body. So good compressions, good chest compressions, gets it around. It gives them 10 minutes to get an airway in, to get everything organized, to get themselves sorted out so that they have everything done and they can go on to advanced life support. It's very simple. It's very easy. It fits into everything. To start doing ventilations in front of 45,000 people is not easy. And it's not 45,000 people that they're doing ventilations and compressions in. It's 45,000 smartphones, which means they're going to be on YouTube and Twitter in 5 minutes. You do it wrong, it's there forever. You're never going to be forgiven, okay? So you've got to be careful about that, all right? Airway management on the field is very simple. Laryngeal mask airway, it goes in very simple, it goes in very easy, it doesn't need much training, it doesn't need much skills, and it does the job that it has to do on these patients, and away we go. Very simple, very easy, get it done and get them off. The question that everybody wants to know, what drugs, when and how? Well, that's very simple on the field. None. Done. End of story. We're not going to worry about that now. We'll get them off and we'll start worrying about it then. What's going to work, and we know what's going to work, what research has showed, compressions, defibrillation, and that's going to work. So let's do that and let's get that done. We're in the field, we're in the open, we're in the environment, we're in front of thousands of people. We've got to get the patient off. So we need to do something which is not taught normally. It's not part of basic life support. We talk about recognition, response, and resuscitation, but we don't ever talk about removal, because they're very different ways of doing things. And removal is very important because you cannot spend hours on the field. You have to get that person off the field. And there are two ways of doing it. You can either get the ambulance that's going to come to the person, or if you can't, you've got to get the person out. And from the moment for where they drop until where you're going to take them, you have to make sure that you are going to carry on doing compressions, that you can't do compressions on the trot unless you do it this way. Well, this way you can do it if you're very good, you've trained, you're skilled, and you've got to make sure that you don't fall off and land up with a head injury, a neck injury, and a back injury, okay, because this can also happen. But there are those people who are crazy enough, like emergency physicians, paramedics, and emergency nurses, who love doing this kind of stuff, and they want it to happen so they can show what they're worth. We're all like that, okay? And if anybody who does emergency medicine in this room disagrees with you, then you're not as crazy as I am. But that's how we do things. But you can't always do that, which means you've got to be able to sometimes move. And that means that if you're going to move, you can't stop for less than 10 seconds. And so the discipline is required here that if you're going to move these people off the field, you're going to do CPR, you're going to get them on your board, and you're going to run for 10 seconds. And the moment your 10 seconds is over, you're down and you're doing CPR again for 1 or 2 minutes. And then you pick up and you run again for 10 seconds. And that's how it's going to happen, because you cannot interrupt your CPR for more than 10 seconds, but you've got to get them off the field. It requires discipline, it requires training, it requires your skill. And therefore, that's why when you have a sports person on the field with sudden cardiac arrest, it is different from the normal sudden cardiac arrest. And all paramedics and anybody who looks after sports fields needs to know that. So what happens? Number 11 of the emergency plan is handing over to advanced life support. And that advanced life support is either going to be in the intensive care manned and equipped level player medical center, which you need to have in every stadium. Because if you're going to have a player medical, it needs to be at that level. So you're going to take the player off the field and take them, then carry on what you need to do out of the public eye and to be able to do it under better circumstances. Or you're going to hand over to advanced life support paramedics inside the ambulance, who are then going to take the patient to hospital doing compressions along the way. Or if you don't have, okay, you may remain on the field if it is appropriate to do so. It depends on what you have at the time that you have. And that's all part of the emergency medical plan that gets mentioned before you even start the game, that everybody knows what their place is, when something happens, who's going to do what. But sometimes in the world you don't have ALS. That's just the way the life is. We play football throughout the world. There are 275 million registered football players. They're all over the world, and some places do not have advanced life support, and then we have to make a decision what we're going to do as to where we go from there, whether we stay on the field or we now need to do basic life support in the back of an ambulance all the way to hospital. And there's a way to do that so that you do effective compression at the back of an ambulance, okay, because the quality of what you do in the ambulance is far more important than the quantity, how long it takes you to get to hospital. So the homework is that there is an app that is being developed which is called CPR 11, which can be downloaded for free in a number of languages, and it has 11 videos, of course, which gives you an instruction on exactly how to handle sudden cardiac arrest in football. It has voiceover, it has videos, it can be used to teach other people, and it can be used to actually use during a sudden cardiac arrest. And it guides you step by step by step on how to handle the different aspects of sudden cardiac arrest on the football field and sudden cardiac arrest in sport, because it is different from the normal environment. Now, I don't think these videos work. I'm going to try this. I'm just going to try this to see if it is going to do what I want it to do. Should we go down to... Yeah, let's go down there. And I want to do... Now, how do I get it? Of course, is Fabrice Mwamba, who's on the left-hand side. He had CPR done for 90 minutes. He had 76 shocks done. There he is. And he's very happy about the 76 shocks and the 90 minutes. No matter whether you shocked, he's happy about that. It took them 2 minutes, 20 seconds to do it. It's too long. We teach one thing. You get to shock within 2 minutes, which is 120 seconds. That's what we do, because we often have a hypertrophic cardiomyopathy, which is a big heart. And the research that's coming out of Germany is now showing that the commonest cause of sudden cardiac arrest in both adults and children is post-upper respiratory tract infection myocarditis. That people are having viral influenza, parainfluenza, they're having whatever virus infection, and they're not giving them time to recover. They just go straight into sport, and the heart doesn't like to play 90 minutes of intensive sport when you've got a myocarditis. And it's not easy to be able to shock them. So sport is different. It is a sudden cardiac arrest. It's young, fit, healthy people. They don't have ischemic heart disease, and they are there to try and remain as healthy as they can, and we need to be able to do something for them. It is a special consideration And I hope, like the European Resuscitation Council, all the resuscitation councils in the world are going to be able to add sport as a special consideration and something that needs to be done. And something that needs to be taught is that today you don't involve yourself in serious sport unless you have an AED. Thank you.